So for the longest time, I had a lot of pain in my neck and my upper back, and I didn't know what it was about. Initially, it would come during stressful periods, and I would say in the last 1 to 2 years, it just became chronic. It was every day or almost every day. But I didn't know what it was about. So one day I went to the posture check in Chiswick Park, and I got my posture check by Michael. And it turned out that I was actually holding myself forward. So my head was not over my shoulders, it was just ahead of my torso. So that created a lot of imbalance, and the weight was just creating a lot of strain on my shoulder. So after that, I came here for full assessment and started the adjustments and the traction. And now I just hold myself much, much better. The pain has completely gone, which is like such a relief. And yeah, I can breathe much better now. Before I could do maybe 2 counts in full inhale, and now I can do 6 without any effort. And I have recovered some grip as well in my hands. And yeah, I've improved a lot in exercising because of all this.
This demonstrates that a lot of our patients come into us after having had symptoms for years, really.
Yes.
And the symptoms that make a patient make the decision to come is often pain. But then when you examine the patient and you take a thorough history, you actually find out that there was a breathing issue. You couldn't really breathe, take deep breath, and had shallow breathing all the time. And then when we did strength test and sensation test into the arm, we realized that the hands and arms were not working as good as they should. But that was not the primary complaint. And unfortunately, as humans, we base our decision to do something about a problem based on pain because we're not necessarily in tune with how well our body is working. And then it comes like as positive benefits of the care that the pain disappeared, but suddenly, oh, I can do this, this, and that as well. And it comes as a surprise, right?
Yes.
So, oh,
Yes.
I can open a jar. Oh, I can breathe better. Oh, I can actually go running.
Exactly that.
Good. Lie on your front. Let's get you adjusted. Massive breath in and out. Lie on your back, please. Well done. Let's go up and get you adjusted. So in this case, we have such a severe change of cervical posture. The cervical spine is meant to have a backwards curvature, the lordosis. But in this case, we actually started off with a neck curve that was forward. So not only had we lost the neck curve, the neck was going the wrong way. Hence the severe symptoms we heard about before. Hence the weak hands. Hence the very shallow breathing. Hence the headache. Hence the pain. So in this case, we are doing a whole series of rehabilitation. We start off with this loaded rubber band, massive rubber band that builds up the musculature and tell the neck to start changing in position. We use that as a warm-up exercise before we start getting into the traction. So now we are setting up to reverse that cervical curvature. So patient is first being stabilized to make sure that the traction is very, very specific in the area where we want to affect. And here is the cervical spine where we want to create that curve that has been reversed. So we have the pull that goes in to the neck. We have a harness that is being put on, and the function of the harness is to create the pull backwards and contract the pull that we are putting right into the part of the cervical spine where we know that we have lost the curvature. The pull around the neck is then being loaded with weight that creates that two-way pull. A person that loses this much of their neck curve has most likely done so as a result of multiple factors. Possible traumas in life could even be birth trauma, sports traumas, road traffic accident, and then a lifestyle of doing things in a certain way. We see a lot of people who have had traumas early in their life, for instance, falling off a horse, etc. When they then get an office job and sit still, the symptoms start developing. But the spine presents an accumulation of what have happened to the spine over years. So obviously, when we start a traction like that, we don't initially start with this amount of weighting, and we don't initially start with 13 minutes. We start just with a couple of minutes and a little bit of weight. And as the body adapts and the ligament starts accepting a new position and the muscle starts taking control, we add more and more. But this is 100% combined with the home exercises that the patients do. So it's literally like a ladder. We take a step at the time where the home exercises are more intense and the in-house exercises are more intense. So it's a hand-in-hand model where 50% of the work is being done by practitioner and clinic assistants, and half of the work is being done by the patient. And then often a change has to be done in the setup of the computer, laptop, and the use of mobile phones, which is why we run our workshops in order to make sure all these things are being addressed. So there's a bigger picture to how you obtain a sustainable solution to these problems.